Part 18, Burns and Electrical Injuries. Welcome to the lesson on burns and electrical injuries. In this video we will discuss how to treat small and large burns. Burns and electrical injuries. Burns can occur from direct contact with any heat source, electricity, or certain chemicals. Burns can vary from minor superficial burns to very deep burns that damage your muscles, tendons, nerve, and even bones. High-voltage electrical injuries can produce devastating injuries and can be fatal. Any electrical injury requires an evaluation in the emergency department. How to treat small burns. Step 1. Ensure that the source of the burn has been dealt with and the scene is safe. Step 2. Make sure to wear a personal protective equipment and get the first aid kit. Step 3. Rinse the burn in cool or cold water. Step 4. Apply antibiotic or burn cream, if no allergies exist. Step 5. Cover with a clean, dry non-sticking dressing. Step 6. Have the individual follow up with a healthcare provider. Do not apply ice to a burn, because it will result a cold injury on top of a burn and cause further tissue damage. Call 999 if there is a large burn, or there are burns on face, hands or genitals, or if the individual is having difficulty breathing, or if there is a fire, or if there is a possibility of carbon monoxide exposure. How to put out a fire. First, stop, drop and roll technique is the best way to put a fire out. Second, you can smother the individual with a wet blanket to extinguish flames. Remove the blanket after the fire is out. How to treat large burns. Step 1. Ensure that the scene is safe, then call 999/EMS. Step 2. Put on personal protective equipment and get the first aid kit. Step 3. Remove the individual's clothing and jewelry, if possible, while you wait for advanced care. This concludes our lesson on burns and electrical injuries. Next we will review bites and stings.